We are running a project, a health system project in Eastern region with that title, Accelerating Epidemic Control in Soroti region. That is Eastern Uganda. When we talk of Soroti, it covers the 8 districts of TASO. And this project is funded by CDC. We started in April. And again, the mantle was given to us by Baylor. So we keep sharing together. Next slide. The purpose is to achieve the UNAID targets 90-90-90 by 2020 through health system strengthening approaches under the emergency plan. That's still the PEPFAR fund. Next slide. This slide, the purple colors show you we go into a cluster system. We have 3 clusters. The purple colors are one cluster, the green colors is the next cluster, the orange is another. And that demonstrates the approaches that we are doing. The Eastern Region project is co-run by other consortium members, the Universal Research Council, and then the Uganda Fish and Fish Conservation Association, with the TASO being the lead partner. The cluster teams are embedded at Soroti, Katakwi, Kumi districts within the district health offices with the aim of increasing intensity in supporting the scale-up at the district level, and knowing that this is a district-led programming, working with the public health facilities, including the private not-for-profit facilities. Thank you. Next. The objective we are discussing here is one of the objectives the project is embarking on. Is one of our 7th objective, strengthening leadership, stewardship, governance in the 100 health facilities and the 80 districts in the region. Okay. This is what I had said, that we came on board with PEPAL in 2012. And we had designated roles in our partnership. TASO had to look at coming up with a project, designing it, and we saw leadership was the requirement. We thought people had the knowledge, had the equipment, had the medicines. They had everything, but they just needed to have components of leadership to make health meaningful and of quality to the beneficiaries. And while PEPAL endeavored to look for the technical teams, to give the technical support, to look for resources, and we worked together from 2012 to 2014, and because of the rationalization program, TASO Uganda was to hand over their health system program to Baylor Uganda, who was taking over the Eastern region. And since the project was designed to benefit the people of Eastern region, we had also to hand over the PEPAL TASO partnership project to Baylor Uganda. And at the end of the time, we observed and participated at a low scale. But me as an individual, it was passionate. Actually, this was one of my loving project that the organization gave me to take lead in. And when I was handing over, even those I was handing over were hesitating. Even PEPAL were saying, let's go together wherever you're going. I was saying, no, my directors say, Eastern region remains with the ETC liabilities and what? And assets. So let it be. Next slide. Okay. What are we doing currently? We are looking at leadership as providing appropriate direction and guiding the commitment from stakeholders, staff, facilitating change, achieving better health services through efficient, creative, responsible deployment of people and of other health sources. We are also looking at leadership as a foundation of quality and responsiveness in health sector to reduce inequalities in healthcare, reverse the downtrends and health-related impact through process of coordinating, planning, implementation at all levels. And when I'm talking of all levels, we are looking at all stakeholders, including the patients themselves, the partners who are working in the place, the health facilities, the districts, the politicians at all levels. So our engagement is covering all the scope. And of course, leadership is not a single-handed. It was already described that it's a multi-sectoral, intra-sectoral, and a multi-sector. The project's vision is that the staff should work as a team and use the available resources or mobilize resources from stakeholders and partners to improve the health and the environment in the region. So that contains our thinking about leadership currently. We also know that what is driving the whole issue is that poor leadership and management of health systems and services have been identified as obstacles to scaling up service delivery, as increasing investment in health and limited results. We all know that a lot of money flows in. That word, a lot of money is mentioned with the reservations, but let's consider a lot of money is flowing in. A number of trainings have been done, that one surely, but management remains a constraint. Ownership, looking at the roles of care as one's responsibility, be it of a politician, be it of a civilian, be it of a civil worker, the health workers themselves, is like nobody's responsibility. The circumstances of ownership at facility. So we think leadership should be able to drive the thinking, the adaptation, the ownership among all stakeholders, so that what we are craving for becomes a result. It makes no meaning if the community is part of the thieves that remove equipment. It makes no meaning if the politician is the one decampaigning his employees. And it makes no meaning if the workers themselves are the ones who divert the resources. So when we are talking about ownership, it is really looking at something of the kind. And now I will be seeing while you don't see. Okay. So our strategies in working around this is engaging all leaders at all levels of governance, cultural, and the health workers to adapt what we know as good components contained in leadership and focus their strength and their time and resources to the people who need care or health care in this case. The other is sharing information with these stakeholders, whether in decision making, in implementation, in monitoring, and this also again at all levels. Later on you'll see just slides that show our engagement of leaders at that level. The other strategy that we have is looking at gaps of health using the quality improvement approaches so that we use data, or the leaders use data to answer into the gaps. That's a bit evidence-based thinking, evidence-based decisions, evidence-based actions. We also engage leaders in building through what we call health promotion, mobilizing communities on knowing information about health, knowing when to access health and where to access health, discussing the health issues in the communities and promoting good practices for health. And we engage them in monitoring the outcomes of their promotions. We also engage them in meetings where they are part of issues that are shared. We also engage them in performance reviews where they are part of discussions of what has gone well and what has not gone well. And performance reviews are scaled down regional, district, and then facility levels so that they are able to look at their data. Then we also engage them in discussing with the communities. And in that way, we feel we are breaking through, and we have already started seeing, especially in HIV/AIDS, where communities are struggling to identify people, refer, and ensure they get services, where we are seeing leaders doing a lot of health promotion, where we are seeing them start solving problems of their health facilities. We had a dilapidated health facility in Pingire, in Ikateta, and like Serere has put aside some money to make sure one of their facilities most affected is being attended to, all VCs are being attended to, and that gives us a picture now that we are having a community-led, a district-led, and so many times client-led health programs. The future, we have all discussed here, and we realize that leadership, apart from skills, knowledge, and attitudes, requires also resources. And that means that we should be looking at and focusing at strategies that generate resources. But also we need to build the mass of health workers into leadership. And this requires also resources. And then that makes me say a statement that we need partners in our region to ensure that we build on the required desire of leadership. My time is off, but also the system is poor. The slides are not running as expected, but to have given you just a pictorial view. This a leader handling issues about quality improvement in one of the districts. Thank you very much. I think